Good evening. I'm Psychiatrist Jay Fawver, live from the Bruce Haynes studio in Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 28th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720. Or if you're calling any place long distance, you may dial toll-free at 866-969-2720. Now on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's mattersofthemind at WFWA.org. And I'll start tonight's program with an email I received this past week. It reads, "Dear Dr. Fawver, can you explain pseudo-dementia? Does that mean that I will get dementia? Is this from long-term psychiatric medication?" Pseudo-dementia, as the name kind of implies, is kind of like a fake dementia. It gives you the symptoms of dementia, such as memory impairment and difficulty with attention span and concentration, but it's not real dementia that is a progressive condition like Alzheimer's disease, Lewy body dementia, vascular dementia, and so forth. So pseudo-dementia is where typically a person is getting older, and as they get older, they have trouble with memory and concentration, but it's related to depression. Untreated depression will give you memory impairment, and especially as you get older, you can notice that. So people, when they get in their 60s and 70s, if they start having memory problems related to depression, it's a term that's been around for a long time, but it's been called pseudo-dementia, where they don't really have the true aspect of dementia. It's related to depression, which is a very treatable form of dementia. Other treatable forms of dementia can be related to sleep apnea, low thyroid, glucose disturbances, and low iron, B12 disturbances. These are all reasons why people can have symptoms of dementia, but they are treatable and they can reverse the whole process. Now, a secondary question you had was, well, with psychiatric medications, do they in turn give you a higher likelihood of having dementia? Some might. For instance, if you're taking medications to offset the side effect of some of the older antipsychotic medications, such as cogentin, Artane. These are medications that are so-called anticholinergic medications. They block acetylcholine, and in blocking acetylcholine is necessary for memory and concentration, but if you block acetylcholine, you can give somebody difficulty with short-term symptoms of dementia and possibly even long-term dementia. Another aspect that can be problematic for some people will be if they take alprazolam, clonazepam, diazepam, lorazepam. These are all the benzodiazepine medications. If you take a benzodiazepine medication for anxiety long-term, that indeed possibly can give you long-term repercussions with dementia, and that's why we're very, very cautious in giving those kind of medications to people who are over 65. They can give you cognitive or memory disturbances for the time that you're taking them, but for some people actually have been shown to have long-term memory disturbances even after they go off of them. The controversy is always there. Do the medications like the SSRIs, the antidepressants, the mood stabilizing medications, do they actually cause dementia? Well, it's kind of a chicken or the egg type of phenomenon. If you take a medication long-term for the treatment of a condition that is associated with dementia, is it the actual condition associated with dementia, or is it treatment itself? For instance, with long-term depression, if it's untreated depression, as you get older, you have a 5 times higher risk of having Alzheimer's dementia. In other words, with long-term depression, holding up my brain here, this is the temporal lobe over here, the hippocampus aspect of the brain is right there, that's the memory part of the brain. It'll shrink down. As you get older, it can naturally shrink down, but when people have Alzheimer's dementia, it'll shrink drastically, such that instead of having perhaps 50,000 connections on each individual neuron, you might only have 30 or maybe 20,000 connections on each individual neuron. It's the branching that often shrinks when you have dementia or long-term cognitive impairment. Well, depression will do that as you get older, and long-term depression puts you at a higher risk for Alzheimer's dementia itself. So untreated depression puts you at a risk for Alzheimer's. Well, you can imagine if somebody gets treated with an antidepressant medication, maybe it'll help some with that, but it might not help all the way. So that's where the controversy has always been. People who take antidepressant medications might have a higher likelihood of long-term memory problems, not because of the antidepressant itself, but perhaps because of the subtle damage that it might be done while they had spells of untreated depression. So We emphasize to people that untreated depression is damaging to the brain. If anything, the antidepressant medications tend to downstream stimulate the natural brain fertilizer. It's called brain-derived neurotrophic factor. There's one called mTOR, mammalian target of rapamycin. These are natural brain fertilizers, and if you stimulate those, it's like firing up your lawn with some fertilizers. So when people have long-term depression, it's like an unfertilized lawn. That's how your brain kind of acts with long-term depression. You need some fertilizer, you need some watering. That's what antidepressants can do. Some of the older antidepressant medications that affected serotonin, norepinephrine, or dopamine did that to some degree, but we have these newer antidepressant medications such as esketamine, also known as Spravato. We have Auvelity, which is a combination of dextromethorphan and bupropion. These medications are affecting glutamate, and within a matter of hours, they are profoundly increasing the brain fertilizing hormones that tend to stimulate that branching, and they do so very, very quickly. Thanks for your email. Let's go to our first caller. Hello, Jerry. Welcome to Matters of the Mind. Jerry, you want to know what's the best way to prevent Alzheimer's disease or slow the process? Number one, a couple of things you can't do, Jerry. You can't stop getting older, and that's the number one risk factor for Alzheimer's. As we all get older, we're at a higher risk for Alzheimer's. Secondly, you can't do anything about your genetics. It is partially genetic. Alzheimer's has a genetic component, but it's not always guaranteed. So what can you do to prevent it? Well, number one, keep exercising. If you exercise aerobic or resistance training, either one are good. So any kind of exercise can decrease the likelihood of Alzheimer's disease. Secondly, keep your weight down. Obese people are more likely to develop Alzheimer's. That's thought to be because obesity itself, the fat, releases inflammatory proteins, which can thereby cause damage to the memory parts of the brain. Thirdly, don't drink any alcohol. And I'm saying any alcohol as you get over 55 years of age. We used to think, you could have a drink here and there, and maybe red wine would actually be better for you. Well, that's the red wine, the aspect of it you can probably get from Welch's grapefruit fruit juice, to give you a brand name of a grapefruit juice there, or maybe purple grapes. But the alcohol in any quantity seems to be damaging to the brain, especially for older adults. So be very careful about any alcohol consumption itself. So exercising, eliminating alcohol. Try to do something about any underlying medical conditions. Many people who were having memory disturbances that can lead to Alzheimer's dementia have underlying diabetes. So if you have blood sugar disturbances, get those under control. Secondly, if you have thyroid disturbances, get those under control. Blood pressure, high blood pressure worsens the likelihood of your having Alzheimer's dementia. And very importantly, as you might have heard me say many times on this program, if you have snoring or a pausing in your breathing at nighttime and you have sleep apnea is a drastic risk factor for Alzheimer's dementia. So you need to get the sleep apnea under control, where you're not having the pausing in your breathing, you're not snoring, and you're using CPAP, auto-PAP, some kind of means to regulate the sleep apnea itself. So those are medical conditions that need to be addressed to decrease your likelihood of Alzheimer's dementia. Another thing you can do to decrease the likelihood of Alzheimer's dementia is socializing. There's something about socializing where we interact with other people on a regular basis, somehow, some way. That seems to decrease the risk of Alzheimer's dementia as well. And finally, learning new tasks, keeping your brain active, keeping your brain busy, doing something with your brain with reading, not just some passive activity like watching television, even if it is PBS. You got to keep your brain active, and in doing so, you need to be actively engaged with conversations, with puzzles, with doing things where you're actually having to think. And you can do those things online, and computerized games are fine, but passive activity like watching old sitcoms on television, not going to be good for the brain for older adults. And so many of us, as we go into retirement, that's what we often end up doing. Have something to do that's meaningful and productive on a day-to-day basis as you get older, especially going into semi-retirement and retirement. Have a quasi-schedule on a regular basis with some ideas on what you're going to be doing day by day by day. Thanks for your call. Let's go to our next caller. Hello, Beth. Welcome to Matters of the Mind. Beth, you heard me mention Spravato a few moments ago. You want to know how it works, and are medications taken via spray more effective? The key with Spravato, it's the left-sided piece of ketamine. So ketamine's been around since 1970 as an anesthetic, and it has some benefits as an anesthetic. Ketamine was developed by an organic chemist at Wayne State University up there in Detroit. And ketamine has been around since 1970, used on a regular basis. Well, it was found about 25 years ago that when people used ketamine IV, they could also have improvement with depression very, very quickly. So it actually got used for treatment-resistant depression, but it was so-called off-label. So you'd have to pay out of pocket. There were no regulations associated with it. And then in 2019, Spravato or esketamine got FDA approved, in other words, officially approved by the government, such that insurance companies would cover it. Esketamine is the left-sided piece of ketamine, and as the left-sided piece of ketamine, it's 4 times more potent on this particular receptor compared to ketamine itself, the entire molecule. And if you use it intranasally, yeah, it will get absorbed better. So if you use various medications intranasally, it gets absorbed better. And that's how ketamine is utilized. People will be monitored for a 2-hour time period, twice a week the first month, once a week the second month, and then once a week or every other week thereafter. And then you talk it over with your clinician on how long and how frequently you use it thereafter. But ketamine and esketamine or Spravato are being used as a means of very quickly stimulating their natural brain fertilizer, brain-derived neurotrophic factor, and mammalian target of topamycin. These are natural brain fertilizers that will stimulate the branching of your individual neurons within a matter of hours. And in doing so, they can be very, very quick and effective means of helping reverse depression. Because I mentioned the hippocampus a moment ago, 50,000 connections per neuron in the hippocampus if it's functioning properly. But with long-term depression, with long-term unmitigated stress that you're not finding tolerable, if you use alcohol, women who are going into menopause, they will all have decreased branching of this memory center of the brain, and that's only a part of the problem because the branching here is extensive, but all around the brain there's extensive branching that's decreasing if you have chronic stress, chronic depression, and so forth. So what we're trying to do with esketamine or Spravato is try to fire up that branching very quickly, and that's why not uncommonly, and it's not placebo effect because it's been assessed versus placebo, but not uncommonly, within a matter of hours after somebody has their first couple treatments of Spravato, they notice they feel emotionally much better and they can think more clearly. Thanks for your call. Let's go to our next caller. Hello, Karen. Welcome to Matters of the Mind.
Okay, here's the deal. Lily has stopped making real Prozac. And in 2001, I started on generic, and I crashed and burned really bad. I had to miss work for 9 weeks, and I was suicidal ideation, okay, and so I went on real Prozac again. Then like 2006 maybe, my doctor switched offices and they put me back on generic, which I didn't realize, but I was crying every day. It's like, what the heck is going on? Until I finally realized, oh, I'm on generic. So yes, it's really expensive, but it's worth it to me because I've seen the black hole and I'm not going back. But now, because, it costs me almost sometimes, depending on where I am in my insurance, $20 a day for the real Prozac, and you could get generic for $2. So I get it. Lily doesn't want to make it, but I feel like I'm cooked. What do I need to do?
There are options, Karen. When you change from, what dosage of Prozac do you take? 20 milligrams? 40?
40.
Okay. That gives me a start. If you're taking 40 milligrams of Prozac, brand name, if you get a generic fluoxetine, which is generic Prozac,
yeah,
you're getting perhaps as little as 32 milligrams of fluoxetine versus 40 milligrams in a brand name Prozac. Because a generic formulation is allowed. It's called bioavailability, bioequivalence actually, but it's allowed. A generic formulation is allowed to have as little as 80% of the brand name dosage, up to 125%, but quite frankly, it's often on the lower side. Brand name Prozac was indeed manufactured. It was formulated by Lilly and it was FDA approved back in 1987. Been around for a long time. Lilly's out of Indianapolis. And then Lilly outsourced the brand name manufacturing, most of it to Taiwan. So it's outsourced to Taiwan, and about 85% of our brand name Prozac came from Taiwan. Since December of 2024, they quit manufacturing brand name Prozac in Taiwan, and I think it's going to be very, very difficult to find it any place, because I've had the same experience with my patients. It's very difficult to find brand name Prozac any place. So here's the options, Karen. Number one, you could anticipate that maybe you're getting a lesser, what we call bioavailability, or bioequivalence. Bioavailability is how much gets into the body itself, so it's kind of similar type of terms. But anticipating that you might be getting less fluoxetine in that 40 milligrams generic formulation that you're getting, you could perhaps, with your clinician's oversight, take an extra 10 milligrams. In other words, take 50 milligrams of generic. That's kind of a backdoor way of maybe getting a little bit more fluoxetine in your system. Preferably, I think, Karen, you might want to go to a different SSRI. Now, you might have tried various other ones before, but some people, well, can do reasonably well on other SSRIs. It is a fallacy to believe that all SSRIs work the same. Yeah, they all work on the serotonin transporter, and that's their main mechanism of action, but they work subtly in different ways. So you might do better on Lexapro versus Zoloft versus Paxil versus Alexa. I mean, you could try various other SSRIs that have similar mechanisms of action than do fluoxetine or Prozac, and they might work as well for you. Another option, Karen, would be to go to an entirely different medication that also affects serotonin, but will have other features, such as a serotonin norepinephrine reuptake inhibitor. You can get those as through Prestique. Effexor is kind of one that we've used, but now that Prestique is generic, we use it more. Cymbalta, also known as duloxetine, they also can be available in a generic form, but they'll be available in a trade name form too. So in other words, what you'd want to do is go maybe to another medication that has a similar mechanism of action as does fluoxetine, knowing that when you get a generic formulation of fluoxetine, you're getting as much as 80% lower dosage, and that's why it might not be working for you. Karen, I'm curious, have you tried other antidepressants outside of brand name Prozac?
No, only brand name. And when I crashed and burned in 2001, I was only on 20 milligrams. And then when I crashed, my doctor put me on 40, which I've remained on. But like I don't feel like the less dosage is what, I don't know. I am getting genetic testing because, I watch your show to see if I'm whatever, a good something. I do have attention deficit.
Okay.
Which Prozac I feel like is good because, sometimes I don't remember to take my medicine, and it's got a 3-day half-life, right? So if I miss one, I don't feel like, oh no, it's all cooked because, okay, one day it's not going to kill me. And
yeah, that is the beauty of Prozac. There's actually a formulation that was available. I haven't seen it used more recently, but it's called Prozac Weekly. It's where you take fluoxetine or Prozac once a week. Now, I don't know if I'd want to get that creative in trying to find you another version of Prozac that is in a brand name. For instance, there's Symbiax that's out there. Prozac Weekly used to be available. But again, you're looking for a brand name Prozac. I don't know if you're going to find one or not, but that's something you could get very creative in trying to find with your pharmacist and seeing where they could acquire something that's like that has brand name Prozac in it, because that way 40 milligrams is the dosage you're getting. I think as if I was your clinician, I'd think about other options that also have similar mechanisms of action as do Prozac. And like I said, you've got Celexa, Lexapro, Paxil, Zoloft, and Luvox. Those are 5 medications that work in the same mechanism of action as do Prozac, but they all do subtly different things, but their main mechanism of action is they affect that serotonin pump, and in doing so, that's what's giving you effect. I'll tell you right now, Karen, based on what you've already told me, I think one of your genetic testing results will be that you're going to have an LA genotype for this particular gene called SLC6A4. SLC6A4 the gene is the gene that we will examine to see if somebody's a good candidate for a serotonin reuptake inhibitor, such as Prozac. Hey, you're getting a good response on Prozac. You're going to have at least, we get 2 genes, one from a mom, one from her dad. And you're going to have at least one gene, and probably both, that are an L or an LA gene itself, depending on what kind of genetic testing you get. So we already know that. Other thing about genetic testing that we can identify is how quickly you break down medications. So you would be able to determine, if you go to another serotonin reuptake inhibitor, which one could you dose at a particular level, or which one do you need to dose higher or lower based on your genetic testing results. So the genetic testing does help determine which direction to go, but I think there's a lot of potential for you, Karen, to go to another type of medication that works kind of like Prozac. And if you have ADHD, Prozac will help some, but quite frankly, we've got some really good stuff for ADHD that also act as antidepressant medications. And that could be determined by your genetic testing as well. But for instance, not uncommon when people have ADHD, they will add a medication to Prozac or take it entirely differently than Prozac, such as bupropion or Wellbutrin is often used specifically for ADHD, but you're getting the serotonin effect from Prozac, and you're exactly right. Prozac does have a long half-life. What else has a long half-life that works kind of like Prozac? There is a brand name medication by the name of Trintellix. Trintellix will be brand name for another year. Its generic is vortioxetine, but we're finding that many people are getting it well covered by their insurance because it is going to go generic in about a year. Trintellix will do the exact same thing Prozac does, and at 40 milligrams of Prozac, you're going to need about 10, maybe 20 milligrams of Trintellix. But that's a brand name medication that's still brand name. It does not come in the generic formulation yet. So if you want to make an easy switch from Prozac to something that still has a brand name formulation, that would be Trintellix. So you can ask your clinician about the possibility of changing from Prozac to Trintellix. What I like about that for you, Karen, Trintellix is metabolized in a similar manner as does Prozac. So if you've done well with Prozac, you could do well with Trintellix. Secondly, Prozac and Trintellix they have a half-life of 3 days apiece. So if you miss a dosage of Trintellix, no big deal there. And the nice thing about Trintellix does the exact same thing that Prozac does, but it also will affect 5 of the 14 different serotonin receptors, and in doing so can specifically help with ADHD symptoms. We've actually used Trintellix specifically for people with depression who respond well to serotonin medications but also have comorbid ADHD. So that could actually be a better option for you, and it just could be an opportunity at this time of your life, Karen, to try something differently. You've been on Prozac for many, many years. You might be ready to go to something that works possibly even better than Prozac for you. And this is kind of a backdoor way of getting you there, but that happens sometimes. Sometimes we just lose the availability of certain brand name medications, and that's what happened with Prozac back in December of 2024. Karen, thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, does weight loss, particularly bariatric surgery, have a positive impact on anxiety and other mental health issues? I've had weight issues most of my life. I'm wondering if a decision to have the surgery will have other fringe benefits. Bariatric surgery include a gastric sleeve Roux-en-Y bypass. These are a means by which you're basically cutting off part of the stomach and you don't absorb as much. We have found over the course of the past couple decades now that people who have bariatric surgery typically have less anxiety and less depression, and sometimes even better ability to think and concentrate, because obesity and the adipose cells themselves do release an inflammatory protein. When you release inflammatory proteins, you will fire up this little part of the brain here in the front of the temporal lobe called the amygdala. The amygdala, if it's fired up, will cause you more anxiety, more fear, more anger. You're going to be more anxious from obesity itself by the adipose tissue firing off this inflammatory protein that goes to the amygdala right there. And downstream, what happens is when you fire up the amygdala, you will also increase activation of the anterior cingulate gyrus, which is right up here. And the anterior cingulate gyrus is the decision-making part of the brain where you're thinking, should I do this or should I not? Well, people with anxiety often ruminate and dwell on stuff, and they go over and over it in their minds. You're firing that up when you have adipose tissue firing off inflammation. So a lot of people who have evidence of inflammatory effects in their brain as a symptom will have a lot of anxiety. What does anxiety do? It makes you tired. It makes you tired because if you have all this anxiety firing up the anterior cingulate gyrus up here, down here in the basal ganglia, it tends to get dampened down some, so it makes you physically fatigued. So that's how anxiety can actually cause you to feel physically fatigued. Many people, when they have a lot of anxiety, and they have depression for that matter, if they have inflammatory components affecting their brain, they'll feel like they have the flu. And when you look at the inflammatory proteins associated with depression and anxiety, they are the same inflammatory proteins as you'll see with the flu, such as interleukin-6, tumor necrosis factor alpha. These are fancy names for inflammatory proteins that are common with the flu as well as with anxiety and depression. And it makes you feel the same. Many people with anxiety and depression will often feel achy all over. And that's where they feel like they have the flu day by day by day, and they just don't feel right. And fatigue, poor concentration, low motivation, lack of initiative for things. These are all symptoms of an inflammatory type phenomenon occurring with anxiety and depression. So, short story long there, but if you have inflammatory proteins being released from adipose tissue, you bet that can make anxiety much worse for many, many people. Thanks for your call. Let's go to our last caller. Hello, Donna. Welcome to Matters of the Mind. Donna, you want to know, does sour candy actually stop an anxiety attack? You know, I think that when you consume something that's enjoyable for you, maybe with sour candy, if something's enjoyable for you and it releases dopamine in the brain, it can decrease panic and anxiety and even depression for some people. It's the association you have with sour candy. Donna, thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. I'm Psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne. God willing and PBS willing, I'll be back next week. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.